What's up, family? So, listen, as a new dad, there are going to be a lot of terms that you hear about your baby that you don't know, but that you need to know. So, here are 20 terms that every dad absolutely must know. Okay, number one, colostrum. Now, colostrum is that thick yellowish milk that shows up before regular breast milk comes in. A lot of dads underestimate it because the volume looks small, right? But colostrum isn't about quantity, it's about concentration. Think of it like a supercharged immune shot, right? It's packed with antibodies, white blood cells, and proteins that protect your baby's gut and immune system, right? It helps seal the baby's intestines, it supports digestion, and reduces the risk of infection, right? That's why people call it liquid gold, okay? Even a few teaspoons per feeding is more than enough, okay? Baby stomachs are tiny at first, and colostrum is perfectly designed for that. When dad's worried the baby isn't getting enough, it helps to know that colostrum is supposed to be small volume, but high impact, right? Number two, Vernix caseosa. Caseosa. I'm hoping I hope that I said that right. But it's that white, waxy stuff on the newborn skin, and it can look unsettling. But vernix is actually a protective coat that kept your baby's skin moisturized and protected while in the womb. It has antibacterial properties and helps regulate body temperature after birth. Some hospitals gently wipe it off, right? Others let it absorb naturally over the first day or two, right? Neither approach is wrong. The key thing for dads is this: vernix isn't dirt or infection or something that needs aggressive cleaning. It's part of how your baby transitions from water to air. All right, so don't think nothing of it. Number three, lanugo. Uh, Lanugo is that fine, soft hair you might see on your baby's shoulders, back, or ears. It's more common in babies born a little early, but full-term babies can have it too. It helps regulate body temperature in the womb. After birth, it serves no real purpose other than making the baby look like Wolverine, and usually falls off on its own within weeks or months, right? No shaving or lotions or intervention of any kind is needed, okay? This is one of those things that looks weird, but it really don't mean nothing long term, right? Number four, meconium, right? This one got me personally. Meconium is your baby's first poop. It's thick, sticky, and black and green, right? This surprises a lot of dads because it looks nothing like regular poop, right? It's made of everything that the baby swallow inside the womb: amniotic fluid, skin cells, mucus, right? Everything. And over the first few days, it transitions to green, then yellow or brown baby poop, right? The main thing dads need to know is that passing meconium is important. If a baby doesn't poop in the first day or so, doctors really pay attention to that. But once it passes and it starts transitioning, you're pretty much in the clear. All right. Number five, jaundice. Jaundice shows up as yellowing of the skin or eyes, usually in the first week. And it happens because newborns' livers are still learning how to process bilirubin. Okay. Now, most jaundice is mild and monitored with blood tests. But some babies need like phototherapy, which is like special lights, okay? They need that to help break down the bilirubin a little bit faster. It can look scary, but it's common and it's effective. What matters is follow up, all right? Feeding well helps clear bilirubin. So dads supporting feeds and diaper changes actually play a serious role here, okay? Number six, fontanelle, which is the soft spot, okay? That's the soft spot on your baby's head, all right? Dads usually freak out a lot, but they're not open holes or anything. There is strong tissue underneath. They exist so the skull can mold during birth and expand as the baby grows. Gentle touching, washing, and brushing are pretty much safe. You're not going to hurt your baby by accident, okay? You call the doctor if the soft spot is bulging when the baby is calm, or if it's deeply sunken or paired with illness, right? But otherwise, it's just part of the normal anatomy. Number seven, the Moro reflex. This is the sudden arm flinging, right? That startle reaction that babies have. It's not fear or trauma, it's a built in survival reflex. Okay. It often shows up when you set them down or there's a sudden sound or motion, right? Swaddling, slow movements, and good head support reduce how often it happens. This reflex fades naturally over a few months. You don't need to fix anything, okay? Just manage around it. Number 8, tummy time. Tummy time is supervised time on the stomach while the baby is awake. Babies hate it at first, right? That's normal, okay? But what it does is it builds the neck, shoulder, and core strength, and it helps prevent flat spots on the head. Okay, even short sessions count. A few minutes, multiple times a day, adds up. Okay, dads are great at this because you can turn it into play, right? Chest to chest time, eye contact, talking. It doesn't need to be formal or anything like that, right? Number 9, positional plagiocephaly, right? This is flattening of part of the head from spending a lot of time lying in one position. It's common now because babies sleep on their backs for safety, right? Most cases improve with repositioning. Tummy time, and varying how the baby lies helps. Helmets are only needed in some cases, right? But sometimes they are needed, which is crazy. It's about balance, though, not panic. Safe sleep still comes first, all right? Number 10, torticollis. Torticollis happens when a neck muscle is tight, making babies prefer turning their head one way. You might notice them always looking like in the same direction, right? Pediatricians often catch this early and recommend stretches or physical therapy. Early treatment works very, very well. It's not a failure, okay? It's just muscle imbalance, all right? Number 11, colic, all right? Colic isn't just a baby who cries a lot. It's a pattern of intense, inconsolable crying in an otherwise healthy baby, usually starting around 2 to 3 weeks old and peaking around 6 to 8 weeks and easing by 3 to 4 months. We just got done with this, right? Now, what makes colic so brutal for dads is that nothing you do seems to work. Trust me, feeding doesn't fix it. Diaper changes don't fix it. Rocking helps, but it don't fix it. And that can mess with your head because men are wired to fix problems, right? And colic doesn't give you a clear fix or answer to what you should be doing. The important thing is this. Colic is not caused by bad parenting. It's not spoiled behavior trying to fix it. It does not mean something is wrong with your baby, right? Many experts believe colic is tied to immature nervous systems, right? Digestion or, just sensory overload. Your baby is basically overwhelmed by being alive and in the real world, okay? That makes sense. What actually helps is motion, right? So walking, bouncing, stroller, cart rides, white noise, shushing, fan sounds, switching off with your partner, so nobody burns out. That help both of y'all mentally and the baby. Accepting, that sometimes the goal isn't stopping the crying, it's just surviving that window. That's something I had to learn. It feels endless while you're in it, but it does end, y'all. And knowing that matters more than any technique that you could do in that situation. Number 12, reflux or GERD or GERD, right? Almost all babies spit up. That's because the muscle that keeps food in the stomach isn't fully developed yet, right? Milk comes back very easily, especially when babies lie flat. Here's the key difference dads need to understand. Reflux, right, is when baby spits up, but it's generally calm, feeds well, and still gains weight. GERD or GERD, whichever how you say it, the baby shows back pain or arching or screaming or after feeds or refusing feeds and poor weight gain. Spit up can look dramatic. It can soak shirts. It can happen 5 minutes after the feeding. That alone doesn't mean anything wrong. I probably got some throw on me right now. But what dads can actually do to help is burp the baby more often than you think is necessary. Keep the baby upright for 20 to 30 minutes after feeding. Avoid aggressive bouncing right after feeds, right? Learn your baby's pain cry versus frustration cry, right? Call a pediatrician if you see forceful vomiting or green or bloody spit up, or if the baby seems, in pain every single feed, or if you notice your baby's not growing. The biggest lesson here is mess does not equal danger. Okay, number 13, fore milk and hind milk. Right, this term comes up a lot in breastfeeding conversation and can cause unnecessary stress. All right, fore milk is the thinner milk that comes first. Hind milk is the creamier, higher fat milk that comes later in the same feeding. Together, they make a balanced meal. Here's what dads should know, right? This is not something most families need to micromanage at all, right? Babies are very good at regulating their intake. Problems only come up if feeds are constantly interrupted or switched too quickly. Okay. The danger isn't wrong or right milk, right? The danger is overthinking feeding instead of just watching the baby. Okay. If your baby is gaining weight, has wet diapers, and seems content after feeds, the milk balance is 9 times out of 10 working. All right. Number 14, lactation consultant. And why they matter so much, right? Lactation consultant isn't just a breastfeeding cheerleader, okay? They're trained medical professionals who understand latch mechanics, which is when the baby latches onto the breast, milk transfers, supply issues, pumping strategies, pain causes. They pretty much know it all. For dads, this matters because, breastfeeding struggles often turn into emotional landmines. Your partner might feel like her body is failing or isn't enough. You might feel helpless, especially if you in it with her, right? Calling a lactation consultant early prevents small problems from becoming big ones. It also reduces guilt and blame and gives you both a plan, right? Encouraging support isn't weakness, it's leadership. All right, number 15, tongue tie, right? Tongue tie is when the tissue under the tongue restricts movement. Some babies have it and feed perfectly fine. Others struggle, okay? Signs it might be an issue are, if your baby is clicking, uh, they have clicking sounds while feeding, if it's poor latch, long feeds with little satisfaction, nipple pain from mom, and slow weight gain. Not saying that those are direct calls or, that those mean anything, but they could, right? Dads make a mistake in believing either it's nothing or it's an emergency, right? A lot of times it's neither. A good pediatrician or specialist would evaluate function, not just appearance. If treatment is needed, it's usually quick and has a high success rate. All right. Number 16, cradle cap. All right. Cradle cap looks rough. Okay. Yellow, greasy flakes on your baby's scalp can make you feel like you're doing something completely wrong. Okay. You're not. Cradle cap is a form of dermatitis. Basically, oil glands working overtime. It's not painful nor contagious. Here's what helps: gentle washing, soft brushing, minimal products. And what we did was we just put some breast milk up there, solve the problem, right? But now, what makes it worse is picking aggressively or overwashing and freaking out. All right. Now, it usually clears up on its own, but try that breast milk, y'all, because that worked for us. Number 17, thrush. Okay. Thrush is a yeast infection, and unlike many baby things, this one does need treatment, okay? It shows up as white patches in the mouth that don't wipe away, fussiness during feeds, diaper rash that doesn't improve. Pay attention because thrush can pass between baby and breastfeeding parent, right? Treating only one often leads to reinfection, and it can quietly make feeding miserable on both sides. The fix is straightforward: medication, but only if you recognize it, okay? Number 18, uh, erythema toxicum, right? This rash looks alarming. It's red blotches with little white or yellow bumps. Despite the name, which is very hard to say, by the way, it's extremely common, and it's also completely harmless and temporary. All right. It often appears and disappears in different places. No cream is needed. No treatment is required. All right. This is a lesson in not letting names scare you more than symptoms or actual real issues. All right. Number 19, milia. Okay. Milia, this is tiny white bumps, usually on the nose or like the cheeks, right? They're basically blocked pores, not pimples, right? Key dad rule: do not pop them. Okay, they go away on their own. Touching them often causes like irritation or infection. All right, number 20, and the last one, corrected age. Okay, for babies born early, development is measured by the due date, not the birthday. Okay, this matters because premature babies may hit milestones later on paper. Okay, it may also mean that babies are still developing on their, original timeline. Okay, using corrected age prevents unnecessary anxiety or unrealistic expectation or constant comparison. Okay, doctors use it for a reason, and parents should use it too. Okay, if your baby's born early, 2 months ain't the same. All right, you got to realize that. But here's the takeaway: most of this stuff looks scary, sounds medical and feels overwhelming, but normal doesn't always look calm. Okay, your job isn't to know everything, it's to learn what's normal, it's to watch patterns, and it's to trust your instincts enough to call for help when something truly feels off. Or to listen to, a podcast like this where I'm helping out and to make sure that we as a community are informing each other and making sure that we, is stay in constant communication, which is what this channel is about. So that's it, y'all. That's the 20 things the 20 terms that dads need to know. Of course, there's more. So feel free to drop more in the comments, but make sure y'all subscribe and